All right, so we're recording, and this is Yvonne Taylor, and I'm with the lovely Holly Campbell. And Holly has been up to a lot of amazing things, guys. She is like the guru for COVID. And rather than, and what we're doing today is this is our next segment on National Minority Health Awareness Month. And I thought who better to talk to us about things health and COVID related than Holly Campbell. And I'm going to shut up and let Holly introduce herself and let her know what she's been up to all of these years. So go ahead, Holly, why don't you tell us a little bit about what you've been up to?
Okay, well, the quick version is that I just changed my whole life in 2019 and rented my home within 24 hours and decided to move to Kansas. And right before, as I call it, the world ended, I got a contract with an organization that has an affiliation with CDC. And I am a correspondent agent where I actually interface with the public all about COVID-19 and now vaccines. And then I have a separate contract with NIEHS, which is the National Institute of Environmental Health and Science, where I teach COVID-19 and vaccine workshops for free to people organizations that would like our services. So if you're listening to this and you say, hey, Holly, you know what? You could come to my organization, just give me a call. And then what we'll do is an assessment of what kind of things you want to know, and we'll set it up from there. And like I said, it's absolutely free to you, which is the best way. And then from there, I am a health and life coach. So I'm pretty busy.
You are busy. And so what we're going to do is we're going to tap into Holly's expertise about COVID. I had the luxury and the privilege of going through her workshop with her. It's amazing how much she knows. And before we get started, I just want to ask you, how are you and your family doing in this COVID world that we're in right now?
Well, that's a good darn question. Well, I interrupted my family by moving to Kansas, and luckily, my son, who's an adult, he moved with me. Although we don't live in the same house anymore, he's still in the state, which is an anchor. And my mom is in Chicago, and most of my family's in Chicago, including my youngest daughter. But then my oldest daughter, she just had a newborn March 3rd, and she has my grandson, who's 3, and they live out in Arizona. So we're all over the place. But the holidays, Yvonne, were really, really tough. I booked a plane ticket for Thanksgiving, canceled it. Booked another plane ticket for Christmas and canceled it. And then, I have my mom who, everybody in our family were, they were under quarantine. My mom basically spent Christmas by herself, which, twice, Christmas and Thanksgiving. So it was tough on all of us.
So with that being said, and you kind of gave us a purview of how COVID is affecting you, we know that that same thing is affecting us, throughout the United States and really throughout the world. Many people are experiencing what you've experienced, where you're separated from your family. So that in a nutshell lets us know that COVID ain't nothing to play with, because it has really uprooted lives. And it's a blessing and a privilege to talk to someone like you who's kind of anchored into COVID and what's going on. We understand how it's affected us as a community because of some of the underlying conditions that we have as African Americans. But it's not just about us too. This is Minority Health Awareness Week. And I'm sure that and it has also affected our Latina brothers and sisters the same way it's affected us, and throughout the line of different people, even our Indigenous American Indians, the original population of this country. All of us are getting hit. But on the other side of that, some of the good news is that we have the vaccines. And so with the vaccines coming, we know that African Americans and everybody, there has been some hesitancy to take the vaccine. And from your perspective at the CDC, what did that look like initially and what does it look like now? And what other information is coming out of the CDC that can give us a little bit more insight to help us make informed decisions? What your thoughts?
Well, let's just kind of start out really quickly and just kind of get an overview of
Okay.
COVID. And we know that it spreads from person to person, and that it is stems from the SARS-CoV-2, which is the virus that causes coronavirus disease, and it spreads from person to person. And when I say it spreads via respiratory droplets, I'm talking about just through coughing and sneezing and singing and talking and breathing, that it produces respiratory droplets. And if someone is infected with COVID, these droplets, get on you. And that's basically how it spreads. And unfortunately, the smaller the particle, the easier it is for it to dry and go into the airstream. And so one of the ways that all of us have known now to prevent it is through wearing a mask, washing your hands properly. I'm not talking about just sliding your hands through the water. We're talking 20 seconds with soap, and then social distancing, and then, of course, to get vaccinated. Now, when we're talking about vaccines, we have an EUA, which is an emergency use authorization for 3 vaccines, which is Moderna, Pfizer, and then now the Janssen's Johnson and Johnson. Now, the Moderna and Pfizer are mRNA vaccines, and you'll need 2 dosages. The first shot, it prepares the immune system and helps you recognize the virus. So that's why when people say, I can't get to the second shot, and I'll circle back around and talk about some of the things that are happening in our community. Some people, don't have access to a bus. Some people don't have access to a computer to even get the vaccine schedule. So that second vaccine is sometimes a deal breaker for people. And so that second shot strengthens the immune response. So that's why it's really important to get both. And so the mRNA can most easily be described as instructions for the cell on how to make a piece of the spike protein. And when you'll see graphics, you'll see that little cell with all the spikes. That's the COVID-19. And I'm not going to get into the whole science about the actual virus because I'm not a scientist. But what I can tell you is that those 2 are the ones that are most spread out through the community and easier to get. And then you have the Janssen's Johnson and Johnson, which I call, one shot and you're done. And that's a viral vector vaccine. And it uses a different version of the virus to deliver important instructions to our cells. And you can do your own research to figure out which one of those vaccines are better for you. But what I want to do, Yvonne, is to address your question. But I want to make sure that people understand, COVID really quickly in the vaccines.
Oh, absolutely.
Is that the reason why the vaccine is so disproportionate to the minority communities is because it goes back, right? It goes back long history. We have environmental racism. We have economic issues that go beyond low-paying jobs. We have political factors, and we all saw how hard it was last year for Stacey Abrams to get Black Americans to be able to have access to even vote, which is their right. And then compounded with that is just generations of unequal health systems and, that put Black people at risk. So we're talking about asthma, heart disease, hypertension, diabetes, and all of those things, especially when you're talking about something that is an upper respiratory disease or issue, infection, is going to compound all that. And we have so many African Americans who have asthma, and let's not even go into lead-based paint and all of that. So redlining, environmental racism has forced Black neighborhoods to breathe dirty air, drink contaminated water, and live in food deserts and feed their children what I call the cheap food that you find at the local corner store. And so all of this is making an extreme inequity. So when people say, well, what's the problem? Well, that's kind of the problem. And I got this data from a New York Times article, and this was based on data from Chicago, which is where you are now, because I'm in Kansas. And it says that Black people account for more than half of those tested in Chicago, but 72% of the COVID-related deaths, which makes up a third of the population, were African Americans. And in Illinois alone, Black people account for 25% of those who have tested positive, and 39% of the COVID-related deaths were African Americans, and that's just making up 15% of the general population. So you see, Yvonne, how that is kind of not balanced.
Yeah, it's very unbalanced. Sorry, my glasses are kind of glaring off the screen and being distracting, but I totally get that. They recently said that there was a little bit of an uptick here in Chicago where people were actually starting to come out and get the vaccine. There was a very encouraging story about a 70-something-year-old man that took two buses to, or several buses, just to get to the United Center to get his first shot. And he's like, well, I don't know about my second shot, but what they're starting to do to address that issue is Uber is letting people know that if they need a vaccine, and I think they have a phone number, if I'm not mistaken, I might not have heard the whole story, where people can contact them and say, hey, I'd like to get my second vaccination, or I'd like to get my initial one. And Uber is giving rides, free rides, to people to get vaccinated. So I'm kind of encouraged by that. But I have another question. It looks like, we still have those disparities going on. That's still true. And we do have these small changes to help us, meet those disparities and get people vaccinated. Have you seen any other in your research or the data that comes across daily, anything to show that there's more uptick in minorities taking the vaccines? Because again, like you said, one, they can't get to them. They can't, you can't schedule, you don't have the computer, we can't get to them. And there's some changes being made, like with the Uber and the phone numbers. Does your data support any things that you're getting, showing anything else that shows African Americans or other populations ticking up and actually taking the vaccine and being able to get it? Have you gotten any?
Well, I'm going to kind of jump ahead because I know that one of your questions that you gave me, you wanted to know what exactly the CDC was doing.
Mhm.
And what I can tell you is that on March 17th, the director, Dr. Walensky, announced that the CDC would invest $2.25 billion to address the COVID-19 disparities in communities that are high risk. Now, that is huge, huge. Now, CDC had been addressing this issue like way back, right when when it first started. They really had talked about these disparities. So the numbers were showing early on that there was a problem. But now this is a work in progress, and you will see that the messaging, I think in the last 3 months, have been really positive, and a lot has to do with, a lot of Black doctors have been banding together to try to make sure that we get the message out there. And then the goal, and let me just circle back to the goal of the actual money, is to give grants to public departments to improve health departments to improve testing and contact tracing, to develop prevention resources. And it lists all kinds of other things that they're going to do. But the most important thing that I see in this $2.5 billion um, investment is that in the next 2 years, you're going to hear more positive messages directed toward minority communities. And I think it's going to level the playing field. And I think the best way for people to take advantage of this money is word of mouth. I mean, you imagine any pastor in the Black community who's not going to be like a dog with a bone if they find out that there's $2.5 billion of of money there? So we have to get access to this money, which is going to be released very soon.
Oh, nice. Well, that's great. That's great to hear that there are more efforts besides the vaccine itself, besides different states putting together things to help people get access to the vaccine. That now the CDC has stepped up to help make those efforts more affordable. That's awesome. So thanks for that education on that. So that, I mean, that's why I said you're the guru, Holly. You understand and know these things, and these are things that we need to know as a people. And with that being said, they're giving us the resources that we need to help uptick and make more positive outcomes for the less served communities. But one of the things that I love that you do is you're part of what I call the education arm. So they're like, you work for a facility that is helping us get those resources, but you're to me a very critical part of that. And one of the things that we talked about and I got to experience that was amazing with you was the education arm of what you do. Like you said initially, you teach people about like COVID and how it affects their organization. So, and now we know we've got all of these resources out there where I look at you as one of those resources,
Thank you.
part of getting the information out. So let's talk a little bit about, now that we got resources and things like that, let's talk a little bit about how we educate folks on that, and how what you do, because I know one of the things you go to organizations, but you talk to me also about employers, right? You
Right.
employers, especially as we're taking the vaccines and now we're actually going to maybe start going back to work. And as that starts to occur, then that's where you are introduced into the picture for those employers and say, what is your workplace going to look like, now that COVID. So maybe you can talk to us a little bit about the educational component that you offered for COVID, if you're okay with that.
Sure. And then I will answer that, but I want to make sure that we talk about the history and vaccine hesitancy too. So I don't want to forget about that because that goes into why the numbers are so low with African Americans getting vaccinated. But
Well,
as
let's chat
far
on that then. Since you brought up the hesitancy, let's chat on that and we'll digress.
okay, because that's really important
Okay,
because
great.
when we can talk about the positive and negative things in history that have kind of paved the way for, when I say our, meaning people of color, reluctance to just trust. And um, a lot of people don't know that there was a slave, and his name was, I hope I'm pronouncing it right, but I think it's one Simus. And he introduced the practice of verulation to his owner, Cotton Mather. And Cotton Mather was, he wasn't, he wasn't all that great of a guy, but he did on some level during this outbreak of smallpox connect the two. So he really wanted to make sure that this verulation process got out to everyone. And he got a lot of pushback, and part of that pushback was because it stemmed from an African American slave. So he went out and found this one doctor who said, "Hey, there is something to this." And they were able to get that virilation process out there. And the epidemic of 1721 would have not been as bad had they been able to reach people quicker and more easier. And then there was Dr. Lewis Wright. He was a Black doctor who introduced the intradermal method of vaccination in the 40s. So those are two positive things that I think that a lot of African Americans don't know, that we do have African Americans who've contributed. Now, whether they are getting their props, so to speak, now I think more people are finding out about them. But then we have Henrietta Lacks. Now, we have many African Americans have been subject to science experiments that, without their knowledge or without their full permission, and not have access to the facts. So in 1951, Henrietta Lacks, who was in her early 30s, she went to a clinic for a cervical cancer biopsy. And we call her cells HeLa cells. And these cells became the first immortal human cell line to reproduce infinitely in a lab. I'm talking about her cells just kept on reproducing, kept on reproducing. And if, just for you to imagine how much her cells reproduced, if you were to put together all of the HeLa cells in the past 70 years, it would outweigh 100 Empire State Buildings and circle the equator 3 times. So Yvonne, I know you got something to say about that.
Oh my gosh. I mean, she's like a super healer. She
is. And so before that time, scientists spent a lot of time trying to keep cells in the Petri dish. And with the endless supply of the HeLa cells, it freed them up. Mm-hmm. So they are still using HeLa cells. And her family, to my knowledge, have not gotten compensation for those cells. And then, of course, we have the Tuskegee study of untreated syphilis in the Black males. And, that went on from 1932 to 1972. And that was funded by the United States Public Health Services and CDC. So the purpose of the study was to observe the natural history of untreated syphilis. Yeah, so think about that. What the heck does that mean?
That we were not human in their eyes, and we were just pretty much walking around lab rats on 2 legs.
Well, when you think about it, even if it had been to treat syphilis, it was untreated. So that meant that there was a whole group of men who they observed what the syphilis did to them.
And we know that all they had to do was look at Adolf Hitler, because he had both syphilis and gonorrhea. And there you had it. You didn't need to test it on anybody else, because you had a living, breathing dictator.
Crazy person.
who was crazy before he got it. And then, woohoo, lights out for that dude. I mean, you had a lab rat, who went through
a lab rat
progression, so you didn't have to think that it was.
So to get back to your question, all of these things lead up to Black people not trusting the government. Mm-hmm. And we laugh about it, but how many times you hear a group of Black folks get together, and you can see it in your family, and they start with those conspiracy theories, oh, I remember back then and back there. So, there's this folklore of oral tradition where we do tell our stories, and part of them I'm sure are grounded and are very true. And so you have these stories of just people having bad experiences, not trusting the government, and they don't necessarily want anything injected in them. So we do, though, have faith-based organizations And many African-American doctors, along with Dr. Kismika Corbett, who was the key Moderna immunologist on the team to help with the vaccine. So I think that with a lot of these doctors getting together and Black doctors spreading the word, there is going to be a shift.
Yeah.
But we got to make sure that, all of the other inequities don't rear their ugly head, and then there's still an issue, because when you think about how you get the vaccine and how you schedule it
Yeah.
online.
Online.
A lot of these people who are part of the first rollout, when I'm interfacing with the public, some of these people are 80 years old. So you're asking them to go online and hunt for it. And my mom is in her 70s and she's got it together. And she was able to do it, but not everybody is like my mom.
Exactly. Like my mom as well. I mean, both of our moms were able to do it. I mean, my mom used to run a data center, so.
Right. And my mom, but one thing that it took though, it took diligence and research on her part.
Yeah.
And not everybody is going to be that committed, because we're talking about it almost became like a full-time job for a couple of days trying to figure out where and how to get the vaccine.
Exactly. Exactly. And so we still have those things that are, like the president is talking about, trying to get broadband widened to all areas, underserved and rural areas. So to your point, we still have the inequities with access to the internet, with access to even a computer, and with access to technology that can get you into that space. So
But one thing I would like, and I don't mean to cut you off, I just want to keep this flowing, because I don't like to bring up a problem without a solution. One of
sure.
the things that is happening now is that the vaccine, well, let me just back up. The ACIP, which is the Advisory Committee on Immunization, they broke out everything in phases. And I think most of us are familiar with whether we are eligible or not. And if you're not sure if you're eligible, you can go onto the CDC website and you'll see the schedule. But what happens is the distribution is on a state by state basis. So it depends on where you live. So let's say in New Jersey, they have, or Virginia, which is one of the states that have been commended on how well they did their rollout. Let's say they've done all of everyone that they're supposed to do, and now they can open it up. So they open it up, and how do you, now that you find out that you listen to the news that you're able to get the vaccine, what happens next? So the first step is you can always go to your local health department and find out what programs are eligible in your state. Then there's the vaccine finder, and that's vaccinefinder.org, which will tell you like in real time what actual vaccines are available within whatever radius you're willing to drive. And then I think one of the biggest programs that I think are that will be the best accessible for African Americans is the federal pharmacy retail program, because that means that you can get your vaccine at Walmart, at CVS, at Myers, and there's I can't give you the exact number of partners, but there are a lot. And then it varies on state to state who's involved. And then we have vaccine spotters, which is similar to vaccine finders. And then if you go onto your Facebook and you just type in vaccines, you'll find that there are a lot of church groups who are sponsoring vaccines. And there is this wonderful little teenager in Chicago who started a network called, I think, Vaccine Angels or something. And his goal was just to help seniors get vaccines. So if you think about that, the rollout just happened pretty much mid-January. We're doing pretty well.
Awesome. Awesome. I know that we didn't want to go too far. I did have quite a few questions I wanted to ask. are coming to the end of our time. So I think that just giving us that wealth of resources to of talking about the hesitancy and what caused it, and how we're turning the corner a little bit, and then giving us that robust list of resources because people are still trying to get a vaccine. Even though they're like, oh, we're opening it up. Okay, that's nice, but where is it? That robust
Right.
list of resources is like gold right now for those of us that do so for those of us that are going to go ahead and get the vaccine. um, I think this has been an amazing time together. I always like talking to you because I learn so much when I'm talking to you, Miss Holly. And I just want to say Holly is amazing. She has a wealth of information. She has learned so much about COVID, how it affects us, what's making us stop, not wanting to take it, what it is, all of
And
that.
I'm willing to, and also too, if, you don't have to be part of an organization. Let's just say, because most of us are from ETHS. Let's say 5 to 6 of you all just want to get together and have a workshop and you tell me the key points. One of the things that I want to do, and I'm going to be working on this weekend, is um, death to the PowerPoint. I'm trying to figure out a way to have a conceptual workshop where we talk about concepts and break into groups and have it more interactive, because I feel that that will kind of be better for all of us to get the information out versus me just going through a PowerPoint. So I want to be able to test that new concept. So if anyone listening wants to get 5 to 6 people and we set something up in the next 2 weeks, I'm open for that. Or your church group or anything like that, we can do a Zoom and just see what happens.
And that's great. So we've learned a lot about COVID, what it is, how it's, you know, what the vaccine is, what creates the vaccine, what are the different vaccines and what they entail. We learned why we as a people are a little bit like, I don't know,
I don't know.
history. And we've also learned if you make the decision to get the vaccine, where you can get it. And we also have this wonderful resource named Holly Campbell to us via Zoom in our small little groups and teach us a little bit more. Holly, I want to thank you so much for, taking this time with me today to educate me a little bit more on COVID and things that we can do to get the vaccine to those of us who are making the conscious decision to do it. Because it is an individual decision. It is, what we have in terms of trying to save our lives and keep us and our loved ones safe. But I also understand it's your individual decision on whether you want to take that road or not.
And
Holly,
I would like to say one last thing real
sure.
quickly is that one thing that we do well is we're entrepreneurs. And I think that this $2.5 billion that's being rolled out, if you start looking up in the next month or two, start looking at grants, see what kind of health initiatives, go to your public health department. And even if you say, well, I don't know what to do. I don't know how to write grants. Trust me, we know enough educated, wonderful people who know how to write grants, and we can figure it out. So let this $2.5 billion be something that we get our hands on and be able to write some grants and get access for our church, or wherever, and be able to, or even let our local municipality know. They may not even know. And if you go to them, they might say, oh, we have plenty of networks there. And there are people who are hired to write grants. So I think that don't let this $2.5 billion get away from us and not be able to put that back into our community with our own thoughts and feelings of how we can use it. Because there's nothing worse than other people thinking what we need. I will tell you, I worked on a grant once where we put rain barrels out into the community. Well, we don't need rain barrels. So, that project didn't quite work that well is what that it could have done, because maybe rain barrels wasn't what the Black community needed. So sometimes if we don't have our decisions and our thoughts in there, that money, although it's good money, might not trickle down to what we really need unless we get out there and let people know what we need.
Absolutely. So Holly, thanks so much. I'm going to put our recording, I'm going to end our recording. We want to thank you for listening.
Nope, I'm off my soapbox.
We want to thank everybody for listening, and we hope you got some information.